Often asked by patients, will a hair transplant leave any scarring in my recipient area and in my donor area? And the answer is yes. The definitive yes. Without any doubt, any sort of procedure, whether it's an FUE, an FUT procedure that involves trauma in the recipient area and mainly in the donor area, will leave scarring. Any cut on the body will leave a form of scar. There is no such thing as having a procedure without having a scar. I have thoroughly discussed this with patients and explained it. Every patient that comes into my clinic is very well made aware of this. It is true that yes, over the course of the last 5 years, the resulting scars in the back donor area when using the FUE technique have become finer and finer, and also the scars in the recipient area are finer nowadays because of the use of the finer sapphire blades or the pre-cut custom blades, but there is always scarring present. Now, the very important thing to mention would be the extraction pattern with the FUE in the donor area, ensuring that enough grafts are being left so that when the hair grows, there will be good coverage in the back donor area, and also that sufficient space is being kept between the extracted grafts so that the resulting dotted scars do not join in order to form a larger scar. Also for the FUT, there is the technique called trichophytic closure, in which I try to overlap the wound edges. The resulting scar can often get quite a few hairs growing through the scar tissue. This can improve to some extent the disguise of the FUT scar, but the hair will need to be kept and grown longer in the back donor area with the FUT to ensure proper coverage. I want to talk also about the slight scarring in the recipient area. Yes, this is present. The area, if you are touching it, can feel slightly rougher, especially in the first 2 to 3 months until the grafts start to grow. As the grafts grow, the resulting area is less visible and less palpable even to touch, but there is micro trauma that is happening there and changes in the blood supply and in the skin texture. However, as long as sufficient care is taken, I haven't encountered any serious problems in the recipient area, but they are described starting from skin necrosis, all sorts of skin complications, which will be explained in detail during your clinic consult, and also problems encountering with very high density and very dense packing of the grafts, particularly in certain areas. So maximum care needs to be ensured in this area as well.